Hey future nurses, welcome to our channel Canadian Nurse Expert. In this video, we will have a knowledge check quiz on acid-base balance. Acid-base balance is a fundamental concept that you'll encounter throughout your nursing career, so let's make sure you have a rock-solid understanding. We're going to dive into 30 challenging NCLEX-style questions, starting with the basics and gradually increasing the difficulty. Don't worry, we'll break down each question step by step and provide clear, concise explanations. Remember, practice makes perfect, so grab a pen and paper, get ready to test your knowledge, and let's crush the NCLEX together. Alright, let's kick things off with a fundamental question. What is the normal pH range of arterial blood? Remember, pH measures the acidity or alkalinity of a solution, and maintaining a balanced pH is crucial for proper bodily functions. The normal pH range for arterial blood is slightly alkaline, falling between 7.35 and 7.45. A pH below 7.35 indicates acidosis, meaning the blood is too acidic. Conversely, a pH above 7.45 indicates alkalosis, meaning the blood is too alkaline. Maintaining this tight pH range is essential for enzyme activity, cell function, and overall physiological balance, so keep that normal range in mind as we move forward. Next up, we're diving into arterial blood gases, or ABGs. What is the normal range for PaCO2 in an ABG? These tests provide vital information about a patient's respiratory status. PaCO2 stands for partial pressure of carbon dioxide. The normal range is 35 to 45 millimeters of mercury. PaCO2 reflects respiratory function. It shows how effectively the lungs remove carbon dioxide. Carbon dioxide is an acidic waste product of metabolism. Inefficient removal leads to respiratory acidosis. Low CO2 levels can cause respiratory alkalosis. Alright guys, let's talk about bicarbonate, or HCO3-. This little compound keeps your body's pH balanced. It's like the Goldilocks of your system. Bicarbonate acts like a buffer, neutralizing acids. Imagine it like baking soda cleaning up a spill. What is the normal range for bicarbonate HCO3-? Normal range is 22 to 26 milliequivalents per liter. Your kidneys are the ultimate multitaskers. Stay tuned. Bicarbonate is key in acid-base balance. But who's directing the show? Which organ is primarily responsible for regulating bicarbonate levels? The kidneys. These bean-shaped powerhouses filter blood and regulate bicarbonate. They keep your pH balanced. Show your kidneys some love. Drink water. Alright, we've covered bicarbonate and the kidneys' role in pH balance. But what about carbon dioxide, or CO2? You know, that gas we exhale with every breath. Turns out it's not just a waste product, it's a key player in acid-base balance too. And the organ in charge of regulating CO2 levels? Your lungs, of course. They're like the air traffic controllers of your respiratory system, making sure just the right amount of CO2 enters and exits your body. Think about it. When you breathe in, you take in oxygen. And when you breathe out, you release CO2. But here's the cool part. The rate and depth of your breathing can actually shift your body's pH. If your blood becomes too acidic, your brain tells your lungs to pick up the pace, breathing faster and deeper to blow off more CO2. And if your blood gets too alkaline, you guessed it, your breathing slows down to retain more CO2. Pretty amazing, right? Let's break down this ABG result. What does a PaCO2 level greater than 45 mmHg indicate? A PaCO2 level above 45 mmHg is a red flag. PaCO2 tells us about CO2 levels in your blood. Your lungs are like exhaust pipes getting rid of CO2. High PaCO2 means your exhaust pipe is clogged. CO2 builds up, causing respiratory acidosis. Why does this happen? Hypoventilation is the usual suspect. It could be a blocked airway or lung disease, or certain medications. High PaCO2 means trouble. We need to fix it fast. So, you got your blood pH results back, and it's below 7.35. What does a pH below 7.35 indicate? That, my friends, means one thing: acidosis. A pH below 7.35 means your blood is more acidic than it should be. Our bodies are finely tuned machines, and even a slight shift in pH can throw things out of whack. Acidosis can lead to fatigue, confusion, and even severe complications. The good news is, our bodies can compensate, but we need to treat the underlying cause. Alright, we've talked about acidosis, but what about the flip side, alkalosis? This is when your blood pH goes above 7.45, meaning it's too alkaline. Alkalosis can disrupt your body's balance and cause problems if untreated. If acidosis is too much lemon juice, alkalosis is too much sugar, both out of balance. Symptoms include muscle twitching, nausea, confusion, and seizures. It's crucial to identify and treat the underlying cause. Stay tuned as we dive deeper into acid-base imbalances. Alright guys, question number 9. Which acid-base imbalance is commonly caused by hyperventilation? So, think about what happens when you hyperventilate. You're breathing really fast, right? And when you breathe really fast, you're actually blowing off more carbon dioxide than usual. Now remember, CO2 is acidic in the body. It combines with water to form carbonic acid, which then breaks down into hydrogen ions. So, if you're breathing rapidly and getting rid of all this CO2, you're essentially getting rid of acid. This leads to a decrease in hydrogen ions, and what happens when you have fewer hydrogen ions? Your pH goes up. That's right, hyperventilation leads to alkalosis, specifically respiratory alkalosis. What compensatory mechanism kicks in during metabolic acidosis? Metabolic acidosis means your body's too acidic due to non-lung issues. This could be from kidney issues or diabetic ketoacidosis. Your body needs to fix things fast. The quickest way? Breathing. So the compensatory mechanism is increased respiratory rate time to breathe faster and deeper. This is Kussmaul breathing, a sign of metabolic acidosis. Breathing deeply blows off more CO2. This helps increase pH towards 7.4. The body strives for balance. Moving on to moderate-level questions. Question 11. A client with prolonged vomiting is at risk for which imbalance? Vomiting leads to losing stomach acid and electrolytes, but you also lose bicarbonate, a crucial base. This loss disrupts acid-base balance, resulting in metabolic alkalosis. Alright guys, let's talk about Kussmaul respirations. Which condition is associated with Kussmaul respirations? This is a specific breathing pattern seen in certain medical conditions. It's deep, rapid breaths, almost like gasping for air. Why does this happen? It's the body's way of compensating for metabolic acidosis. In acidosis, the blood becomes too acidic. The body tries to blow off excess carbon dioxide. This is a sign of diabetic ketoacidosis, DKA. In DKA, the body breaks down fat, producing ketones. Ketones are acidic, leading to metabolic acidosis. If you see Kussmaul respirations, think DKA and get medical help immediately. Let's dive into respiratory acidosis and what to do when you encounter it. Respiratory acidosis happens when your body retains too much carbon dioxide. Something interferes with your breathing, preventing CO2 expulsion. What is the priority intervention for respiratory acidosis? Imagine a clogged pipe, water backs up. That's your lungs with respiratory acidosis. Clear the blockage and get ventilation going. Ventilation is your best friend. Encourage deep breathing exercises, use a bag valve mask or mechanical ventilation. The goal is to expel CO2. Address the underlying cause but prioritize restoring ventilation and balance. Okay, future nurses, let's put your detective hats on and decode this ABG together. What does a pH of 7.50 PaCO2 of 28 mmHg and normal HCO3- indicate? We've got a pH of 7.50. This is on the higher side, indicating alkalosis. PaCO2 is 28, pointing towards hyperventilation. Hyperventilation blows out too much CO2. Normal bicarbonate means kidneys haven't compensated yet. This ABG screams hyperventilation. Consider anxiety, panic attack, or pain as causes. Pop quiz. What happens when your kidneys aren't working properly? In other words, which imbalance is likely in a client with renal failure? Renal failure spells big trouble for acid-base balance. Kidneys maintain pH balance in your blood. They filter out metabolic waste, including acid. Failing kidneys can't remove acid effectively. Acid builds up in the bloodstream. This leads to metabolic acidosis, a serious condition causing many problems. Monitor acid-base balance closely. Regular blood work and medications help manage acidosis. Early detection and treatment are key. Electrolytes are crucial for health, but acid-base imbalances can disrupt them. Which electrolyte imbalance is common in metabolic alkalosis? Metabolic alkalosis can cause hypokalemia, a drop in potassium levels. This happens when potassium shifts from the bloodstream into cells. As pH rises, blood potassium drops. Potassium is vital for nerves, muscles, and heart function. Low potassium can cause muscle weakness and heart issues. Monitor potassium levels closely if you have metabolic alkalosis. All right, future nurses, let's decode some arterial blood gas, ABG results. A pH of 7.28 Pa, CO2 of 54 mmHg, and HCO3 minus of 24 milliequivalents per liter indicates which imbalance? Our patient has a pH of 7.28. That's below the normal range, indicating acidosis. The PaCO2 is 54 mmHg, higher than normal. This indicates CO2 buildup in the blood. The bicarbonate level is normal at 24 milliequivalents per liter, so we have acidosis with high CO2 and normal bicarbonate. What does this tell us? This points to respiratory acidosis. The low pH and high CO2 confirm it. The normal bicarbonate suggests no compensation yet. Mastering ABGs is about understanding these relationships. All right, guys, picture this. You're on vacation, maybe tried some questionable street food, and now you're dealing with diarrhea. Not fun, right? What condition results from prolonged diarrhea? The answer is metabolic acidosis. Diarrhea can mess with your body's pH balance. You're losing fluids, electrolytes, and bicarbonate. Bicarbonate is a base, and we need a balance of acids and bases. Losing too much leads to acidosis. This causes fatigue, weakness, and even confusion. Diarrhea isn't just a digestive issue. Stay hydrated, replenish electrolytes, and keep that pH in check. Let's talk about panic attacks. Which acid-base imbalance is most common in panic attacks? Intense fear, racing heart, dizziness, and difficulty breathing. Rapid, shallow breaths can disrupt your acid-base balance. Exhaling more carbon dioxide makes your blood more alkaline. This is called respiratory alkalosis. Once the panic attack subsides, your body corrects the imbalance. Time to solve this ABG mystery. A client's ABG shows pH 7.48, PaCO2 35 mmHg, and HCO3 minus 30 milliequivalents per liter. What is the diagnosis? We're looking at pH, PaCO2, and bicarbonate. pH of 7.48 indicates alkalosis. PaCO2 of 35 is low. Lungs are compensating by blowing off CO2. Bicarbonate is high at 30. This is our biggest clue. Kidneys are retaining base. High pH, low PaCO2, high HCO3. We're dealing with metabolic alkalosis. It's all about connecting the dots. All right, guys, here comes the difficult questions. Question 21. A client with a pH of 7.33, PaCO2 of 48 mmHg and HCO3 minus of 28 milliequivalent per liter has which condition? We've got a pH of 7.33, PaCO2 of 48 millimeters of mercury, and bicarbonate of 28 milliequivalents per liter. pH 7.33, that's low. We're talking acidosis. PaCO2 is 48, which is high. High PaCO2 means more CO2 in the blood, making it more acidic. This points to a respiratory cause. Bicarbonate is 28, slightly elevated. Kidneys are compensating by holding on to more bicarbonate. This is partially compensated respiratory acidosis. We need to treat the underlying cause and support their breathing. Interpreting ABGs is like solving a puzzle. Look at the pH, CO2, and bicarb to get the full picture. Keep practicing, and you'll diagnose these imbalances like a pro. Question 22 is all about diabetic ketoacidosis, or DKA. Which intervention is most appropriate for metabolic acidosis in DKA? DKA is a serious complication of type 1 diabetes. The question asks about the best intervention for metabolic acidosis in DKA. The answer is administer insulin and IV fluids. In DKA, the body breaks down fat for fuel due to lack of insulin. This creates ketones, which are acidic, disrupting pH balance. The priority intervention is insulin. Insulin allows glucose into cells, stopping fat breakdown. It's like a bouncer letting glucose into the cells. Without insulin, glucose is stuck outside, causing fat breakdown. This leads to dangerous ketone buildup. Insulin stops fat breakdown and reduces ketone production. This helps normalize pH and pull the patient out of acidosis. All right, question 23. Let's analyze this ABG. A pH of 7.37, PaCO2 of 52 mmHg, and HCO3- of 30 milliequivalent per liter indicates what? pH 7.37, PaCO2 52 millimeters of mercury, and HCO 330 milliequivalents per liter. At first glance you might think, hey, that pH is normal, and you'd be right, it technically falls within the normal range. But don't let that fool you. We've got some sneaky stuff going on here. Look at that PaCO2, it's 52, which is high, meaning there's too much CO2 in the system. That screams respiratory acidosis. Now check out the bicarbonate, it's 30, which is also elevated. This tells us the kidneys are working overtime trying to compensate for the high CO2 levels. They're holding on to bicarbonate like it's going out of style to buffer that acid and keep the pH in check. So, we've got a situation where the pH is normal, but only because the kidneys are working so hard to compensate for the underlying respiratory problem. This is what we call fully compensated respiratory acidosis. It's like a wolf in sheep's clothing. It looks normal on the surface, but there's a serious imbalance lurking beneath. It's crucial to remember that a normal pH doesn't always mean everything is hunky-dory. We need to look at all the values in context. In this case, we need to figure out why this patient is retaining CO2. Could be a chronic lung condition like COPD, or maybe they're having a severe asthma exacerbation. Whatever the cause, we need to treat it aggressively to bring that PaCO2 down and give those hardworking kidneys a break. All right, question 24. What causes metabolic alkalosis from too many antacids? They neutralize stomach acid. Excessive use tips the scales. Bicarbonate overload causing metabolic alkalosis. Balance is key, folks. Question 25 throws us into the deep end. What acid-base imbalance is most likely in a patient battling sepsis? Sepsis is a life-threatening condition. It wreaks havoc on your body's systems. This can cause a buildup of lactic acid. And what happens when lactic acid accumulates? You got it, metabolic acidosis. Question 26 gives us another ABG to decipher. What does a pH of 7.29, PaCO2 of 33 mmHg, and HCO3- of 18 milliequivalents per liter indicate? pH is 7.29, indicating acidosis. PaCO2 is 33, lower than normal. Bicarbonate is 18, also low. This points to metabolic acidosis with respiratory compensation. The body is fighting back, trying to restore balance. Alright guys, let's tackle a tricky aspect of acid-base imbalances complications. What is the primary concern in respiratory alkalosis? In respiratory alkalosis, calcium is a major player. Alkaline conditions affect calcium in your bloodstream. Calcium binds more to proteins in an alkaline environment. This reduces free active calcium. Free calcium is crucial for muscle contractions, nerve impulses, and blood clotting. Monitor calcium levels in respiratory alkalosis patients. Watch for hypocalcemia signs like muscle twitching and spasms. Severe cases can lead to seizures. Address hypocalcemia to prevent complications. Treat the underlying cause of alkalosis. This helps restore acid-base balance and calcium levels. Let's break down this ABG. A pH of 7.50, PaCO2 of 55 mmHg, and HCO3- of 35 milliequivalents per liter indicates what? pH is 7.50, indicating alkalosis. PaCO2 is 55, higher than normal. HCO3- is 35, also elevated. High pH and bicarbonate indicate metabolic alkalosis. Elevated PaCO2 suggests compensation. Lungs retain CO2 to balance pH. This is a classic example of the body's equilibrium. Metabolic system tips towards alkalosis. Respiratory system counterbalances. Always analyze ABG values together. Metabolic alkalosis with partial respiratory compensation. Treat the underlying cause and understand compensatory mechanisms. Salicylate overdose, like from aspirin, disrupts acid-base balance. Which acid-base imbalance is common in overdose of salicylates? Initially, it causes respiratory alkalosis. You breathe faster, blowing off CO2. Then it shifts to metabolic acidosis. Salicylates mess with metabolism, causing acid buildup. This makes it a medical emergency. Mixed respiratory alkalosis and metabolic acidosis. Suspect overdose? Call 911 immediately. Early treatment is crucial to save lives. Okay, nurses, listen up. What is the priority nursing action for respiratory acidosis in COPD? When it comes to respiratory acidosis in COPD patients, you need to be super careful with oxygen therapy. I know it sounds counterintuitive. Why wouldn't you give oxygen to someone struggling to breathe? Here's the deal. COPD patients rely on a different mechanism to breathe. Their bodies get used to higher levels of CO2. Giving them too much oxygen can actually suppress their respiratory drive, making them breathe even less. That's why careful monitoring is crucial. You need to find that sweet spot enough oxygen to improve their oxygen levels without completely shutting down their breathing. It's a delicate balance, and you'll learn all about it in your respiratory nursing courses. Fantastic work! These 30 questions have taken you from basics to complex acid-base balance scenarios. Don't forget to like, subscribe, and comment below with topics you'd like us to cover next. See you in the next video.